Hey nursing fam, welcome back to the Traffic Triage Map Strategy series. This is part 3, the traps of the yellow zone. If you're studying for the NCLEX and finding it hard to prioritize care in those tricky multiple choice questions, then you're in the right place, right? We've already talked about the red zone, those act now, save a life situations. Now the yellow zone, this is where most people get caught. The answers, they generally sound right, it feels urgent, but it's not a priority right now. At the end of this video, you'll know how to spot those sneaky yellow zone traps and confidently avoid them on test day. And don't forget, I've got a free red and yellow zone checklist for you. The link's in the description below. As you are studying for NCLEX, I want to remind you that the NCLEX is testing your safety, clinical judgment, and your ability to determine what you should or would do first. So by the end of this video, you'll be able to 1. Describe the characteristics of a yellow zone answer, 2. Recognize when something looks urgent but it isn't, 3. Avoid common yellow zone traps, 4. Improve decision-making speed by using the TTM filters or colors. In video 1, I introduced you to the Traffic Triage Map, which helps you to sort your NCLEX answer choices by using the TTM colors or filters. So we have the red zone for those act now, save a life scenarios. We have the yellow zone for those watch closely and or monitor because it could get worse scenarios. And we have the green zone for those stable, routine, or safe to delay or delegate scenarios. Now, please remember it is important to connect the color to what the question or the STEM is asking. So let's break down the yellow zone. So the yellow zone means monitor closely. These patients are not crashing, but they're not completely fine either. It's a watch carefully and be ready type of situation. So, for example, a new post-op patient who's stable but groggy, or maybe a diabetic patient with borderline blood sugar levels, or a patient with a low-grade fever after surgery. Now, these things do matter, but they don't come before a patient who's actively bleeding or seizing or can't breathe. That's where the trap actually comes in, right? However, the situations that I just described could progress to a red zone or the patient getting worse if we don't monitor and manage them closely. All right, let's look at some examples of yellow zone traps. So you might get answer choices that include actions like reassess in 30 minutes, which sounds responsible, right? But if this is a red zone question, this would not be the correct answer. What about educate the patient, right? Education is important, yes, but teaching a newly diagnosed diabetic how to inject insulin is not more urgent than addressing a patient who is actively experiencing a hypoglycemic event. What about documenting findings? Don't fall for this one because documentation is necessary, yes, but it never comes before stabilizing a patient who's crashing. And then offer emotional support. Of course, we care about mental health, but it doesn't take priority over physiological safety. So these types of actions would be appropriate for yellow zone types of questions, but not red zone type questions. So for the most part, NCLEX is not just testing what you know, it's testing what you'll do first. That's why we need to think like a nurse in an emergency department and not a nurse in the classroom. So you need to ask yourself, as you go through the questions, is this patient in immediate danger? Is anyone crashing, right? Can this task wait? Or would it be safe to delegate this to an unlicensed assistive professional, so a UAP, or an LPN? If the patient is not in immediate danger or something that can be delayed or documented or delegated, it's likely a yellow zone or a green zone, which you will learn more about in the next video. And to help you practice this, I've created a free checklist with clear clues and decision tips for both the red and the yellow zones. And you can download it right now by clicking the link below. Remember, every question is trying to challenge your thinking, but the NCLEX wants the safest answer. As you work through your practice questions, some cues that should trigger you to ask, is this a yellow zone answer choice? Would be, for example, moderate pain, 4 to 7 out of 10, maybe nausea or vomiting, or if there's indication of mild dyspnea in a chronic condition, or even slightly elevated temperatures with signs of early infection. Maybe there's abnormal labs with no symptoms, or the client has complaints without a change in their vital signs. These would all be considered yellow zone cues. And some keywords would be to reassess, monitor, follow up, evaluate response, report if worsens. So basically, you would yellow zone it if the evaluation is monitoring for potential complications, or if there's a possibility the client's condition could worsen if not watched closely. So you're checking the response of something that is new or not yet stabilized. So, for example, if you are asked in the question to evaluate the client's response to a new antihypertensive medication that was started this morning, this would be considered a yellow zone question looking for a yellow zone answer. Why? Because you are assessing for effectiveness or looking for adverse effects, and this could actually turn into a red zone if there is truly a problem. So it's basically a watch closely situation. All right, so here we have some question samples. So let's look at the first question, and it's recognizing a red zone priority. So a nurse is caring for 4 clients. Which client should the nurse see first? Is it client A, who is reporting nausea after chemotherapy? Is it B, a client who's experiencing a hypoglycemic event and is diaphoretic? Is it client C, who needs a preoperative teaching session before an afternoon surgery? Or is it D, the client who is requesting assistance ambulating to the bathroom? So here I know that this is a clinical urgency type of question because my strategic word here is first, okay? So I need to determine which of these clients do I need to see first. So let's work our way from the bottom up. So client D is a client who's requesting assistance ambulating to the bathroom. This is definitely important, but it would not be on my top of the list actions that I would need to do, right? So it wouldn't be necessarily a client that I would see first. It's more so a client that I probably could delegate to an LPN or to a UAP in order to assist the client. So I'm going to put this client in the green zone, and I know we haven't gone into depth in terms of determining who would generally fall into the green zone, and we're going to do that in video 4. But for now, I'm going to say this is a delegation type of action or task. Client C is a client who needs preoperative teaching. So we also learned in this video that teaching falls in the yellow zone. So this client's going to be in the yellow zone. Client B is a client who is experiencing a hypoglycemic event and is also symptomatic, okay? So this tells me that I need to go into action immediately, okay? So this here is a red zone. So I need to act now and save a life, because if I don't, this client can actually go into a diabetic coma. So then we have client A who's reporting nausea after chemotherapy. This is very important to manage as well. However, I do know that nausea after chemotherapy is an expected symptom for a client. So I'm going to place this client in a yellow zone for now. So as I go through, I know, okay, this is a first. So this is a clinical priority type of question. So I'm looking for a red zone answer choice. And my only red zone answer choice is my client B. Okay, and that is the correct answer. Choices A, C, and D, they fall into either the yellow zone or the green zone, and they are important, but they're not urgent. All right, question 2. The nurse is assessing a post-op client who is 48 hours post-abdominal surgery. Which finding requires follow-up and continued monitoring? Is it A, a blood pressure of 88/48 and a heart rate of 124 beats per minute? Is it B, slight redness around the incision with mild discomfort? Is it C, client who reports lightheadedness when getting out of bed? Is it D, a dressing that is dry with minimal serous drainage? So when I look at this question, I am seeing that this is a follow-up and continued monitoring type of question. It is not a prioritization or escalation question. So this is going to trigger me to say that this is a yellow zone question, and therefore I'm looking for yellow zone answer choices. So let's go through our answer choices. So let's start from the bottom again. So we have D. So a dressing is dry with minimal serous drainage. So this is a normal surgical finding and no follow-up is generally required. So I'm going to say that this is a green zone type of answer choice. C, the client who reports lightheadedness when getting out of bed. So lightheadedness, yes, is subtle and it isn't life-threatening yet anyways, right? However, it tells you something could be developing. Maybe orthostatic hypotension, maybe low fluid volume considering their, post-op, and also maybe early bleeding. But it's my cue to reassess this patient throughout my shift maybe. So I would put this patient in the yellow zone for now. And then B, so slight redness around the incision with mild discomfort. So this is an expected mild post-op inflammation. So it's the normal process of healing. So I'm not going to worry too much about this at this point. So I'm going to say that this is a green zone answer choice because it's expected. Now A, where the blood pressure is 88/48 and heart rate is 124 beats per minute. Now this shows me that this patient is unstable, right? So we have unstable vitals with hypotension and tachycardia. And this client is showing that they're probably going into shock and requires immediate action. However, the question didn't ask me who needs help right now. It asked me who needs follow-up, okay? So even though this is a red zone answer choice, it is not the correct answer for this one, right? So follow-up and continued monitoring is a yellow zone type of question. So in this case, the correct answer here is C, okay? So when you see a stable client with a new symptom that's not dangerous yet, I want you to pause because the client is not crashing, but we know that something is off, right? So with the lightheadedness, we know something is off. We just need to closely monitor this patient. But you're not going to panic and you're definitely not going to ignore it and walk away. We're going to reassess it and follow up, okay? All right, next. A nurse is caring for a client with a concussion sustained 8 hours ago. Which finding would require monitoring? Is it client A who becomes drowsy but responds to voice? Is it B, client reports mild headache and asks for acetaminophen? C, the client's GCS drops from 15 to 12? D, the client reports feeling anxious about their injury. So right away, I know that this is a yellow zone answer, or like question answer, because in the question, it asks me about which finding would require monitoring. So it's not asking me what's wrong, but it's asking me what should I keep an eye on. So it's the perfect setup for a yellow zone answer. So let's work through our choices, starting from the bottom. So D, the client reports feeling anxious about their injury. Totally understandable. I get it. But at this point, this is an emotional response to their injury. It's not they're not in physical danger. So this would be a green zone answer choice. C, the GCS drops from 15 to 12. Well, this is very concerning, right? Because the client went from 15 to 12 in GCS, so they have a neurological decline with the drop in their GCS. So this is dangerous and requires me to act right now. So I'm going to put this patient in, or this finding in the red zone. Now, the client reports mild headache and asks for acetaminophen. So we know that patients with concussion is expected to experience headaches. So this is a stable symptom at this point. So I would put this finding in the green zone. And then the client becomes drowsy but responds to voice. So drowsiness after a head injury, it could be normal or it could indicate early increases in intracranial pressure. So this needs to be monitored closely. So I would put this finding in the yellow zone. So because this question asked us which finding would require monitoring, the correct answer here would be A, which is where the client becomes drowsy but is still responsive. Okay, so they're stable for now, but it's my job or your job to catch deterioration before it actually happens. And also for this question here, right, this can be a yellow zone trap because automatically when I look at my choices, I see that, answer choice C, which is GCS score, drops from 15 to 12. So I would want to act on this immediately, which is correct. You want to act on it immediately, but only if the question was asking you what should you or which finding would require immediate action from the nurse, right? But in this case, it's asking us which finding would require monitoring. I wouldn't monitor this GCS drop from 15 to 12. I would want to intervene right away on this one. So that's why in this situation, the correct answer here would be A. All right, let's work through a few more questions. The nurse is caring for a client 6 hours postpartum. Which assessment finding requires follow-up? Is it A, moderate lochia rubra with small clots? B, fundus is firm but deviated to the right? C, client reports fatigue and cramping? Or D, uterus is palpable at the level of the umbilicus? So right away, I see here, it's asking me which assessment finding requires follow-up. So this is a yellow zone question. So I'm looking for a yellow zone answer choice. So we'll work from the bottom up. So D, the uterus is palpable at the level of the umbilicus. So this is the expected location for a 6-hour postpartum. So I'm going to say that this is a green zone answer choice. C, the client reports fatigue and cramping. This is normal for early postpartum. So this is another green zone answer choice. B, which is the fundus is firm but deviated to the right. So this actually suggests that the bladder is distended and displacing the fundus. So I would say that this is a yellow zone question because we need to monitor that. So no further complications can occur. And then A, so this is expected discharge for postpartum. So I would say this is also a green zone answer choice. So the correct answer here is B. Okay, so this one was fairly simple, right? So let's do the next one. A nurse is reviewing lab results for a stable client. Which result requires the nurse to monitor and reassess? Is it A, a sodium of 132, B, potassium of 6.5, C, WBC 18,000 with a fever, D, hemoglobin of 5.5? So right here, I know that this is a yellow zone type of question because it says monitor and reassess, and the patient is also stable. And so my answer choices, the correct answer choice would have to be a yellow answer choice, right? So let's work our way from the bottom up. So we have a hemoglobin of 5.5. This is dangerously low, so it needs immediate action. So I would put this in the red zone. C, WBC 18,000 with a fever. This is telling me that an infection is happening. And so I would need to make sure and get some action on that. So this is a red zone. Potassium 6.5 is critically high and can cause arrhythmias. So I want to put this in the red zone. Now, A, sodium of 132, it's not that bad. It's slightly hyponatremic because the normal is 135 to 145. And so I would need to monitor for confusion or worsening of the sodium level and symptoms. And so it's not critical yet, but I do need to monitor and reassess it. So I would put A in the yellow zone. So the correct answer here is going to be A because it's asking about monitoring and reassessment. Now, another question you should ask yourself is, within the NCLEX question, did a yellow zone symptom turn into a red zone situation? For example, if nausea turns to vomiting blood, it's urgent and is a red zone. If pain goes from 5 to crushing chest pain, it's urgent and is a red zone. Always ask, is this a stable or unstable patient or situation? We really have to watch for those very closely as well. All right. I hope that going through these yellow zone question types was helpful because the yellow zone traps are real, but now you know how to see them coming. If you found this helpful, hit like, drop a comment, and make sure you subscribe so you don't miss part 4, which is the green zone mastery. And don't leave without grabbing your free traffic triage checklists. Right now, I have available the red and the yellow. And when the green zone video drops, you will also have access to the green zone checklist. It's a game changer. So until next time, keep studying smart, think like a nurse in the emergency room, trust your gut, and remember red equals act now, yellow equals monitor and could get worse. And also, the most important thing to remember is that you were made for this. All right.